Hello, my name is Dr. Carlo with AnxietyBoss.com. Today, I will talk about 5-HTP for depression. 5-HTP, also known as 5-hydroxytryptophan, has studies showing its effectiveness and safety for depression. 5-HTP is the precursor of serotonin, which is the neurotransmitter in the brain that is hypothesized to be deficient in depression. So on the right hand of the slide you see tryptophan, which is the precursor for 5-HTP, which in itself is the precursor for serotonin. On the next slide, I will detail the Tryptophan-5HT pathway. So here you have tryptophan, which turns into 5-hydroxytryptophan that is catalyzed by the enzyme tryptophan hydroxylase. 5-HTP then is turned into serotonin via the enzyme aromatic L-amino acid decarboxylase. So with the serotonin hypothesis of depression, it posits that depression is caused by a deficiency of serotonin in the synapses of the neurons of the brain circuits that modulate depression. SSRI antidepressants are often utilized to treat depression, where they increase synaptic serotonin by inhibiting the reuptake of serotonin presynaptically. However, SSRIs come with significant side effects and require a doctor's prescription. There are natural alternatives which have studies showing effectiveness and safety in the treatment of depression, and I will go into that. So 5-HTP is a natural depression supplement. 5-HTP is an aromatic amino acid that is produced by the body from tryptophan and is involved with the production of serotonin, as I outlined earlier. Commercially, 5-HTP is produced by extraction from Griffonia simplicifolia seeds. Thus, oral 5-HTP is a natural dietary supplement and has been used in the treatment of depression for the past 40 years. So now I will go into 5-HTP depression studies. When taken orally, 5-HTP increases serotonin in the synapses, as 5-HTP is a precursor of serotonin. There are multiple studies showing that 5-HTP is effective and safe for depression. There are 27 clinical studies of 5-HTP for depression, of which the majority of studies showed that 5-HTP was effective and safe for depression, as outlined in this study by Levino et al. 2011. The majority of the studies administered between 200 milligrams to 300 milligrams per day of 5-HTP. At this dosing range, 5-HTP is well tolerated, and the most common side effects include nausea, vomiting, and diarrhea. However, there has been an SSRI backlash. The reason for the lack of the use of 5-HTP in the treatment of depression is because of the focus and huge marketing blitz of the SSRIs, where the SSRIs have dominated the treatment of depression since the late 1980s. However, with the ongoing backlash against the SSRIs and its numerous side effects, people are seeking natural and safer alternative treatments for the treatment of depression, such as the natural dietary supplement 5-HTP. Fortunately, there is a natural 5-HTP formulation that can treat depression safely, and this is called Kalm Mood Support. You can find out more about Kalm Mood Support at kalmpro.com. If you want to find out more about depression, please visit depressionboss.com. Thank you for listening. I'm Dr. Carlo.